Guys, welcome back to Medical Coding with Blue. Today's episode is all about, should you quit your medical billing and coding program? If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys. So no one can tell you to quit a program. Nobody can tell you that. Only you can come to that decision. Okay. I will say this though. This episode is about a viewer's comment that I got, but I want to point something out. If you are getting into this and you have just barely gotten into the program and it's starting to be like, oh my gosh, there's all these things to learn, and naturally it is overwhelming, but it's not a reason to just quit. To me, that's just a lame excuse to quit. It's a lazy excuse to quit because it's so much you didn't know. Obviously, you're getting into this field. Not everybody, you're not born being a medical coder. You're not. You have to learn this stuff. Medical coders have to know what a doctor knows while never having gone to medical school. Now, I don't say this to scare you. I'm telling you so that you are prepared, because a lot of people think that, oh, it's so easy. I've gotten so many people from master's degree level education to just high school diploma or GED say the same thing to me. Blue, I thought this was easier. I don't know where you got that from. I don't know who told you that. But that is far from the truth. Medical coding is about critical thinking. It is about reading. It is about understanding the whole disease process. It's about understanding the treatments. It's about understanding the provider's documentation and what they're trying to say, because their documentation is what we are using to select these codes. These codes that are selected affect statistics. They affect the patient in as much as that these codes are going to be based on what they're going to be paying for this provider. It affects the provider because if we are not doing our job appropriately, that provider is going to lose money. And when the provider loses money, it's a trickle-down effect. Then they can't get equipment that they need. They can't hire additional staff. They can't, get all these other supplies. They can't do all of these things because the coding is off. So there's a lot of responsibility on us. And yes, it's not meant for everybody. You will find that out sometimes, like after you've been in it for a while and you think, man, this is really not what I thought it was going to be. And maybe you decide to do something else. That's all fine and well. But what I am going to talk about today is I want y'all to think about some of these things before you just go ahead and say, oh, I'm going to give up. Because so many people just give up so easily. And the fact that it's so easy to give things up, to me, it's sickening. It is sickening because people just throw away education like it's nothing. And you throw away your chances of getting into a career and building yourself into this career. And you have to remember that we only get one rodeo. This life that we are all in right now today, we only get one. There is no dress rehearsal for this. There is no, oh, we're going to try that again. There is none of that. You get so much time and then that's it. Whatever you do with it is up to you. And if you allow other people around you to influence what you do in your life, that's a sad life to me. Because of the simple fact that you're always going to be going based on wherever the wind blows. If somebody doesn't want you doing this, oh, I'm not going to do that. Or if so many other people, they don't do it, or they don't like it, or they don't want to get into it, then you're not going to get into it. You're not going to like it. You can't think for yourself. That's what I want you guys to think about today when you're thinking about this. Because if you're watching this video, you may be watching it because you support my channel. And you also may be watching it because you're in this situation. Like, should I quit? But I want you to think about it. I'm going to give y'all some things to think about. But let me read this so that y'all can see where this episode came from, because my episodes are inspired by you, all a viewer. I have tons of videos on my channel about the career field of medical coding, where to start, how to start learning, what books to get, where to apply and things like that. When you get out in the real world, how to handle providers and how to do this and how to do that. It's all over my channel. So here's the message. It says, I am currently in a program, and I'm going to stop real quick and say this first. This comment was piggybacked off another comment, and that other comment was talking about how she's very confused about CPT coding, right? Very confused about CPT coding. And I told her, I responded to the other person. I said, you need to make sure that you're doing, is all it's going to take is practice. That's all it's going to take. It's just some practice. Put in 20 hours per week and you'll be fine. You can do it. Just get to it, you know. This other person responded, okay? But I said in that post, 20 hours per week. This person says, I am currently in the program. I passed anatomy and physiology part of the program, which means that she's in the beginning part of the program, right? Just started the CPT class last week. I'm having trouble understanding. You've only been in it for a week. It is difficult to study at work. You shouldn't be studying at work. You should be doing your job at work. You should be studying after you get out of work so you have the time to concentrate, okay? So I'm not sleeping a lot. I have no idea what that means. I got in the program because I wanted to do something different. When I started, I was so excited, but now I'm asking myself if this is for me. Not even in it, only a week into CPT and already questioning if this is for her, right? So far, 5 people from my class withdrew from the program. So because 5 people withdrew, you want to withdraw now too? One part of me wants to give it up and the other is not. I love reading, listening, and learning, but I didn't know the program was this hard. I am not spending enough time trying to study because of work. What do you recommend, Blue? How many hours does it take the average student to need to pass, to spend the time studying to be successful? P.S. I tried studying at work, but there are too many interruptions. Because you're supposed to be at work, ma'am. Because you are supposed to be at work. And first of all, I already answered that question in the same thread that she was on. I mean, you're not paying attention. 20 hours per week. 20 hours per week. It's not that hard, guys. It really isn't. I'm going to do another video talking about how you can get that 20 hours in, even with a full-time job, even with a family and kids and pets and goats and chickens and farm animals. You can get the time in if you want to. But just looking at this message right here and the fact that this person is saying, well, 5 people quit. So what? So freaking what if they quit? So you're going to quit too? You're going to allow other people who probably don't have a good support system or are not doing their research to know how to remedy how they feel or how to find ways to get into study and things like that. Or maybe because they're just overwhelmed with their home life and they thought it was going to be easy, and maybe they're trying to raise little ones and they don't have anybody else to help them. So maybe that's why they quit, or maybe there's just a myriad of other reasons that cause them to quit. But you're going to go based off of what they're doing. 5 people in your class quit. It's not uncommon for medical coding schools to start off with a lot of students and then dwindle down to about 10 or 5 people all the way at the end of the program. That's not unusual. It's not unusual. But the thing about it is that adults are not taught how to study. And if you are not a researcher, which a lot of people are not, if you are not a researcher, it's going to make it even harder, because if you do a little bit of research, sometimes you'll get into a certain algorithm in Instagram, and you'll see a lot of those study tips. I get a lot of them because I follow a lot of doctors. I follow a lot of residents that are sharing their journey through medical school. And the only reason that I do that is because sometimes they post like anatomy things, so I'll follow along. Or sometimes I get like what they're saying, even though I'm a coder and I understand what they're talking about, so I follow along with them. And then I follow nurses as well. I will never be a nurse. I have no interest in nursing at all. But I do follow them because a lot of their study tools that they have, sometimes they post stuff, it's very helpful for coders. It's helpful for coders because it gives like those little tips on how to remember things and things like that. So that's what I follow those nurses for, and plus medical humor to me is funny. So, but that's just one of those things. But that's something that people can do to start learning how to study and pick up some good study habits and formulate how to get a plan to study. Because a lot of times people think that it's all about cramming, that they're going to cram in 6 hours. They're going to cram all their studying into 8 hours, and then they're not going to study for 5 days. Oh, but I've already studied for 8 hours this week. Not even the correct way, because none of that's going to stick, you know. But I don't like the idea of the follow the crowd type deal. That means you can't think for yourself. You can't think critically. You can't formulate your own path and your own way of doing things in life. Just because 5 people quit doesn't mean you have to quit. If the school is not teaching you, and if you're not learning from your instructor, there are other ways to mitigate this problem. You can study on your own. The books that I recommend, the 2 workbooks that I recommend, are in the description box below. Somebody who got smart and said, I can't find anything in the description box. If you can't find anything in the description box, I literally cannot help you. I literally cannot, because it's literally right there. Independent study with book recommends. If you can't find that, don't ask me, please, because I cannot help you. I can't. And that's just one of those things that I don't spoon feed. I make it so easy, because I have everything listed, that I cannot justify to myself to spoon feed to people. Why? Because it's just going to make the next generation of coders weak. And I'm not about that. I am about y'all, building y'all up so that y'all can be strong and y'all be out there prepared for the real world. And to be able to get those opportunities, and to be able to work in things that you want to work in, and find those little joys in life, in your working life. Because I don't believe that you have to work all these years and then retire and then be happy. For me, I have not worked, and I put this in air quotes, because when you love what you do, you never work a day in your life. In 2014 is when I figured that out. When the light bulb went on, when I had my aha moment. I call it my aha moment. And I have that because it was just like this light bulb went on, like, I'm excited to get to work. Now I get it. I want to get to work. I want to talk with my providers. I want to be able to teach. I want to be able to do all of these things. And the more I put into it, the better I understood the documentation. I started reading the New England Journal of Medicine. And that was so cool. Even though I still read it today, but some of those words just go right over my head. But it's okay, because I understand things a lot better now because of the time that I put in. And when I very first started learning medical coding, I was very excited, because at the school that I went to, you had to, every class that you went into, as soon as you completed that class, you got your next set of books. And the school is no longer there. So please don't even ask me. It's a trade school that they taught a bunch of different things, okay? But it was all self-directed. It was self-taught and things like that. All you had to do was go in front of a computer and learn from your book, and that was it. And was there times when I didn't get some of those things? Absolutely. But I will tell you guys this. When I was in the school, one of the things, I was getting through at a pretty good pace because of where I was in my life at the time. I was in my mid to late 20s. I was into my mid to late 20s, and I was going through a divorce, and I had moved back in with my mom, okay? Because I went from my mom's house to my husband's house and then back to my mom's house when I was going through this divorce. And so meanwhile, I had this negativity in my ear going through this divorce and things like that. But I had to get myself back up on my feet. I had to get going again. And so I knew that as soon as I got done with this program that I could go out and get a job, and I could go out and get back up on my feet and things like that. Well, as I'm going through this program, I'm going through it at a pretty good pace. I enjoyed medical terminology. I enjoyed learning about anatomy. And it was back then, okay? This was back in 2007 was when I was in school. And going through at that time, there wasn't all this YouTube. There wasn't all these channels and things like that to help, you know. There was none of this. And there was certainly nobody like me on YouTube to explain this stuff. So I'm going through on my own. I had my mom as my support, in which I'm so grateful for, because I will always say that it's because of my mom that I have my career, okay? And so when I was going through this, and I was going through it at a really good pace, well, all of a sudden I got to the evaluation and management portion. And then they told me at the school, they go, Bleu, you're doing a really good job getting through and making good time, making good pace. But you got to be careful with this evaluation and management. There's a lot of people who fail evaluation and management. There's a lot of people who just quit because they don't get it. I said, well, mess on that. I'm doing really good. I'm going to figure this out. So they said, okay, well, here's your evaluation and management book. That book is way out of date, so don't ask me about it either. And so I get the book, and they said, okay, read this, read this, read this. I get the syllabus. The syllabus is the one that tells you what to read and where to go and things like that. So I was looking at it. Well, it was only recommending to read certain chapters of this book so that you could keep pace. No, I was not going to fail this class. I was going to make sure that whatever happened, I was going to pass this class on the first try, because I had been around other people and they were saying, oh yeah, evaluation management is so hard. I know I've gone through it a couple times already, and I don't know what I'm doing wrong. So I was just like, no, I have got to do this right. I'm going to take my time and get through this. I read that freaking book cover to cover. Everything. I read everything. There was nothing that got left out. I read everything. And so when I was at the school and I was doing my work at the school, because, I want to sneeze so bad. That's why I'm sorry. But when I was at the school and I'm working through these things, and some of the other girls were noticing that I was doing more than they were doing. And they were like, why are you doing that? It only tells us that we need to read this, this, and this. And I said, yes, but it's not working. That way is not working. And so I need to understand this. So I'm going to read the whole thing. Well, you're doing too much, and that's just doing too much. And I was like, no, I'm going to do it this way, and I'm going to get through this. I'm going to understand what this is. And sure enough, I got through on the first try, because I went and I figured it out that I needed to read from cover to cover, but I had to give myself the time to be able to learn it. Was it confusing at first? Heck yes. What do you mean evaluation and management? I don't understand this. Why does this come up? But I read it, and then after a while, then I understood. And so then I was able to pass it, which is why I've always had the ability to be able to understand evaluation and management better than a lot of my other coworkers, because I've taken the time to learn it. I've taken the time to study it. I've taken the time to review the guidelines whenever they come out, the new ones and things like that. So because I've taken that time, it's not so hard for me anymore. If you expect to understand something after just a week of working with it, you're in la la land. That's just la la land completely. There is no excuse for that. That's just not even logical to walk into something thinking that you're going to automatically understand it. It's ridiculous. And having that kind of expectation on yourself sets yourself up for failure. There is wanting to do a good job. There is wanting to do things right. And then there's setting yourself up for failure. Walking in, being arrogant enough to think, oh yeah, this is going to be a piece of cake. This is going to be so easy because everybody else says that it is. And then when you get into it, then you're just like, oh, wait a second, maybe this isn't easy. Oh, now I'm questioning if I should be doing this. That's just, why can't you just stick with doing something? Why do you have to sit here and question? That's wasting time. It is completely wasting time. And that's what a lot of people are doing, is that they are wasting time with questioning whether they should be doing this or not, instead of spending the time to study. Instead of spending the time to study, they would rather sit there and question, am I doing the right thing? Is this what I should be doing? Instead of just working through the workbook, looking up the codes, taking the time to look through the book. And if you walked in thinking that this is going to be a cakewalk, why would you ever think that? Oh, because people said that you can use the encoder. You think you still don't have to read and understand? Because there is some of these computer-assisted coding programs, right? That I've seen a lot of really goofy things, because in computer-assisted coding, they will highlight certain words. I want to sneeze so bad. They will highlight certain words to help you to understand, okay, like this is the code, and this is what we're going to start working with in the encoder, right? And so one of them was fall. So it's saying that there's an injury here, when actually that wasn't the case. It was that the provider was discussing the season of the year, not an injury. So the computer assisted coding was wrong for that. The other one was the provider said the patient was aseptic. Aseptic means they don't have sepsis. Well, it only highlighted septic, because why? Because maybe the provider paused when they said aseptic, and there was a space in between. So all the computer saw was septic. So if you are not paying attention, you might have picked up that the patient has sepsis. Why? Because you saw it there. You can't critical think. That's what I'm saying, is that you have to be able to critical think. My channel is all about telling you guys that you have to study, you have to critical think. To get questions like this is insulting. It is so insulting. And then the fact that you want to give it up after 1 week, maybe it isn't for you. Maybe you should quit. Maybe you need to learn hard lessons over and over and over and over again, because maybe you'll get it right after a while. Instead of just seeing it through, go through the program, whether it's hard or not. If something gets really difficult to you, like in this part right here, what is the easiest thing that this person could have done? It's so hard. It's CPT. I don't understand it. First thing you need to do is actually sit with your CPT book and look at it. Open it up. Go through each and every single page. Go through the chapters, because in CPT, the AMA CPT Professional Edition that we all have to have as coders when we're taking our test, this is going to give you a lot of examples. There is coding tips throughout the book. And that was part of my summer challenge, which the summer challenge is almost over. And a lot of y'all still haven't said anything about like where you are. Did you complete it? Did you do it? But there's a lot of tips throughout that CPT manual. And I told you guys to break it down, right? Do 4 chapters in a month, and just be able to break it down that way. And then look through all of those. Just look through them. You don't have to read everything, but look, so that way you can get familiar with where everything is. But no, some of you would rather spend the time tabbing the books. And for what? Because you think it's going to make it easier for you to be able to navigate in the book? No. What makes it easier for you to navigate in the book is by working with the book. I can't tell you guys how many times, and this has been since the very beginning, how many times I've been able to just open the book with no tab, no nothing, and go exactly where I need to go. And I've done that quite a few times in front of my providers. They're like, how did you do that, Blue? It's a trick. It's a magic trick. But it's just spending time with the book. When you start there and just do that basic thing, trust me, it's going to start making more sense. The more you get into it, the more you practice, the more you expose your mind and your brain to these things, the easier it will become. If you get so impatient with yourself that you don't understand it on the first day, oh my God, that's it. Why? Because you're looking for reasons to quit? If you are, you're a grown-up. You can quit. You can quit if you want to. You can quit if you want to. No one's going to hold you to it. No one can judge you for quitting. No one. No one can. Because it's all up to you. But I will say this, though. I will not. Whether you quit or not, it doesn't make any difference to me. Because, like I said, I'm already in my dream job. But find something in life and stick with it. Don't just sit here and look for an excuse every single time, because you're going to be running from job to job, from career to career. And what is it, being a jack of all trades but a master of none? Why would you do that? Why would you do that to yourself? Why would you deny yourself the career that you could have? My career is fantastic. I love my career. When I first started, and I worked at the Cancer Therapy Research Center, and then I went on to hospital coding, and then I went on to here for my forever home. And being here at my forever home, as a professional, as a person, I've grown so much in the 15 years. I just had my 15-year anniversary at my work, and they gave me like a certificate and things like that. which is really nice. I like that. I like recognition. I don't get that a lot as far as like, oh, you know, this and this and this. But to get something that says, hey, you've been here for 15 years. I got one also for 10 years because they do that 10 years, 15 years, and 20 years. And I'm already, already going to be in, you know, 4 point something years, I'm going to be at 20 years. And that's amazing. I have worked with very awesome providers. I enjoy what I do. I look forward to going to work. Yes, there are some things that are chore related that I have to do at work because that's just the ins and outs of it, but I'll accept that. I'll accept that if it means that I get to still do what I do, and I still get to teach my providers, and I still get to help patients, even though they will never know who I am. I walk by patients all day in the hospital. I don't know them, they don't know me. We are anonymous to each other. But I know their histories. I know their codes and things like that just by spending time with their records. And to me, it's something that I take personally, as far as like, I want to make sure that their stuff is done right, because I would want that for me. I would want somebody who's coding my stuff to care and to care enough to do the correct coding. That's what I would want, you know? And I when I was a little girl, I wanted to be an attorney. That never went away. But this is an awesome alternative that life put in front of me, because as I have said before, you know, medical coding found me. And so if medical coding found you, then you owe it to yourself to see it through and to stop running. Because if you're always going to continue to run, you're going to be running from everything. You're never going to get that chance to have that aha feeling, to know what it's like, to have that, oh my gosh, I'm so excited to be here. Yes, there is that excited feeling when you're in the beginning part of your career and you're like, oh yes, I'm so excited, I get to go to work and blah, blah, blah. And then it becomes a regular rigmarole and you sort of lose that feeling. Well, of course, I was excited in the beginning, but in the beginning it was a job because I didn't know any better, because I didn't know it was a career. And it wasn't until 2014, that's when I got it. That's when I understood. So when I see new people, when they tell me, oh, Blue, I'm so passionate about coding. No, you're just excited, but it's okay. You'll figure it out. You'll figure it out. But don't do things just because other people are doing them. If they quit, let them quit. Let them quit. Don't you quit. Don't you give them that. Oh, I'm going to quit too. And these people that are in the stupid Facebook groups, oh, well, I quit because so-and-so said this in the Facebook group. You let somebody in a Facebook group stop you from doing what you could be doing, like a career, a well-paying career, and before any of you gets fresh, oh, well, no, they don't pay anything. When you start off, you're going to start off at an entry-level salary, obviously, but it doesn't mean you're going to stay at that salary. When I started at the Cancer Therapy Research Center, I started off at a pretty good rate, but because I was patient, I got 2 more bumps in pay that first year. So 3 different pay scales I went through in the first year. Doing very well. Thank you very much. I'm just saying. So with that said, y'all need to quit thinking about all these other things and stay focused on what you got in front of you, because it's too easy to just be in all this other stuff that you don't even need to be. Don't be worrying about other people. Quit looking at other people. Quit paying attention to what they're doing, because their life is not your life. This is not a dress rehearsal. Yet again, this is not a dress rehearsal. You guys need to be paying attention to what you're doing. If you're confused, if you're lost, find a mentor. A mentor will help you for free. If you need further help, you need somebody who's going to dedicate that time to you and be one-on-one with you, then you hire yourself a tutor. And I don't want to hear complaints about hiring a tutor. If you have money for Starbucks and all these other stupid things, Target and all this other stuff, you got money for a tutor. You got money for a tutor, because that's maybe 1 or 2 things that you can do for yourself to help you to understand. And it's not every single week. It's not every single time. It's however much you're willing to invest in it. But maybe you just have some questions that you need answered, and that's what you need to do. Okay, and people have different ways of tutoring. My tutoring rate and contact is in the description box below. There's also a lot of other tutors on LinkedIn. Now, if I wasn't willing to share, because trust me, the table is big enough for all of us to eat. Okay, it's literally big enough for all of us to eat. And again, they're all over LinkedIn. If you need a recommendation, you go in there and you ask. But quit quitting because somebody else is quitting. That's all I'm gonna say. With that said, I'm gonna wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I'll see you all next time. Bye.